Question. A 65-year-old female with a history of hypertension and type 2 diabetes is admitted to the hospital for uncontrolled blood glucose levels. The following lab results are available. Blood glucose, 250 milligrams per deciliter. Hemoglobin A1C, 9.5%. Serum potassium, 3.2 milliequivalent per liter. Serum sodium, 139 milliequivalent per liter. Creatinine, 0.9 milligrams per deciliter. BUN, 15 milligrams per deciliter. The physician orders the following medications for the patient. Insulin glargine lantus, 20 units subcutaneously at bedtime. Potassium chloride, 20 milliequivalent orally daily. Metformin 500 milligrams orally twice daily. Which of the following is the most appropriate nursing action based on the patient's lab results and medications? A. Administer insulin glargine as ordered, but withhold potassium chloride due to the patient's low potassium level. B. Administer insulin glargine and metformin as ordered, but delay the potassium chloride administration until serum potassium levels rise. C. Administer all prescribed medications, but monitor potassium levels closely after the first dose of potassium chloride. D. Withhold insulin glargine and metformin due to the patient's high blood glucose and refer to the healthcare provider for alternative medications. Answer. C. Administer all prescribed medications, but monitor potassium levels closely after the first dose of potassium chloride. Rationale. A. Incorrect. Withholding potassium chloride may worsen hypokalemia. Potassium replacement is necessary, and the potassium level should be monitored closely, but it should not be withheld altogether. B. Incorrect. Delaying the potassium chloride administration could be dangerous for the patient, as she already has a low potassium level. Potassium chloride should be administered as prescribed, but the nurse should monitor levels after the first dose. C. Correct. The patient has hypokalemia, serum potassium 3.2 milliequivalent per liter, so potassium chloride should be administered as prescribed. Monitoring potassium levels closely after the first dose ensures safety, especially since insulin administration can lower potassium further. D. Incorrect. Withholding insulin glargine and metformin would not be appropriate in managing uncontrolled blood glucose levels. These medications should be administered as ordered, and the nurse should monitor the patient's response to treatment.